This channel serves to educate and inform, yet it doesn't replace expert medical counsel. Remember, your medical queries and concerns should always be directed to a professional. Diagnosis, treatment, or any health-related advice? Seek the wisdom of your physician or a qualified health provider. Let this be a springboard for learning, not a substitute for professional guidance. Dive in, absorb, but always consult with the experts for your health matters.
Have you ever wondered why high blood pressure, also known as hypertension, is often referred to as a silent killer? It's a condition that forces your heart to work harder, quietly increasing your risk for serious health problems like stroke and heart failure. Despite its prevalence, it often goes unnoticed, lurking in the shadows without showing visible symptoms, making it a silent yet potentially deadly condition. This is why it's critical to understand this health issue that affects nearly half of adults in the US. Let's dive into understanding this critical health issue that affects nearly half of adults in the US. So what exactly is high blood pressure? Well, in simple terms, high blood pressure, also known as hypertension, is a condition where your heart pumps blood with more force than normal. This exertion can result in health risks, such as stroke and heart failure. Blood pressure readings are measured in millimeters of mercury, abbreviated as mmHg. Each reading consists of two numbers. The top number, called the systolic pressure, represents the force your heart exerts during a heartbeat. The bottom number, known as the diastolic pressure, measures the pressure in your arteries between heartbeats when the heart is at rest. Normal blood pressure typically falls below 120/80 mmHg. However, if your blood pressure consistently reads above this range, you might be dealing with high blood pressure. It's important to note that occasional high readings aren't necessarily a cause for concern, but if these readings persist, it could signal a problem. Now that we understand what high blood pressure is, let's explore what causes it. What triggers our heart to pump blood harder, leading to high blood pressure? A crucial question that deserves attention. High blood pressure, or hypertension, can be a sneaky adversary, often showing no clear symptoms until it's too late. But what causes this silent threat? To begin with, there are two main types of hypertension: essential and secondary. Essential hypertension is the more common of the two, with no clear origin. It's like a mysterious novel with missing pages. This type often creeps up gradually over the years, linked to a mesh of lifestyle factors. A diet high in salt, a lack of exercise, and even stress can contribute to its development. It's a subtle reminder of how our daily choices can shape our health. On the other hand, secondary hypertension is a direct result of other health conditions. It's like a domino effect where one health issue leads to another. Kidney disease, hormonal disorders, and certain medications can be culprits behind secondary hypertension. Unlike its essential counterpart, secondary hypertension tends to appear suddenly and cause higher blood pressure levels. Age and family history are also significant players in the high blood pressure game. As we grow older, the likelihood of developing hypertension increases. And if your family tree is sprinkled with cases of high blood pressure, your chances of facing the same foe are higher. Let's not forget about the role of lifestyle choices. Smoking, excessive alcohol consumption, lack of physical activity, and an unhealthy diet are all factors that can push your blood pressure up the scale. It's like adding fuel to a fire. But remember, knowing the causes is not about placing blame. It's about understanding the factors at play, so we can take steps to reduce our risk. After all, our body is an intricate machine, influenced by a myriad of factors both within and outside our control. Understanding the causes is the first step in prevention. But what if you already have high blood pressure? What are the signs? High blood pressure often doesn't show obvious symptoms, but what should you look out for? It's a bit of a paradox, isn't it? A condition as serious as high blood pressure often moves like a stealthy cat in the shadows, showing no signs until it's severe enough to cause serious health problems. This is why high blood pressure is often referred to as the silent killer. It's not being dramatic, it's simply the truth. Despite this, there are symptoms you should be aware of, especially those associated with a hypertensive crisis, a severe increase in blood pressure that can lead to a stroke. Symptoms of a hypertensive crisis can include severe headaches, shortness of breath, nosebleeds, and severe anxiety. More alarming signs include chest pain, vision problems, and difficulty speaking. These symptoms require immediate medical attention and are a strong reminder of why regular checkups are so important. But let's rewind a bit. Before a hypertensive crisis, are there other signs to look out for? Well, some people with high blood pressure report headaches, shortness of breath, or nosebleeds, but these symptoms aren't specific and usually don't occur until high blood pressure has reached a severe or life-threatening stage. This is why knowing your numbers is so crucial. Regular blood pressure checks can help you keep track of your health and act as a preventative measure. Remember, the top number, or systolic pressure, represents the pressure in your blood vessels when your heart beats. The bottom number, or diastolic pressure, represents the pressure in your vessels when your heart rests between beats. Understanding these numbers and what they mean is a proactive step in taking control of your health. Recognizing these symptoms can be a lifesaver. But remember, prevention is always better than cure. Don't wait for the symptoms to start, stay ahead of the game, and keep an eye on your blood pressure. How can we control this silent killer? This question is often on the minds of those diagnosed with high blood pressure. But fear not, managing this condition is not as daunting as it may seem. It involves a combination of lifestyle changes and medication, as well as regular checkups to monitor progress. Firstly, lifestyle changes are the cornerstone of high blood pressure management. This includes adopting a healthy diet, rich in fruits, vegetables, and low-fat dairy products, while reducing the consumption of saturated and total fat. A diet low in sodium is also highly recommended. This is not just about skipping the salt shaker at the table, but also being mindful of processed foods, which can be high in sodium content. Regular physical activity is another key factor in controlling high blood pressure. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could be anything from a brisk walk, a bike ride, to even gardening. It's all about finding an activity you enjoy so it becomes a part of your daily routine. In addition to lifestyle changes, medication may be necessary for some individuals to manage their high blood pressure. There are several different types of medication available, and your healthcare provider will work with you to find the best one for your specific needs. And let's not forget the importance of regular checkups. These allow your doctor to monitor your blood pressure and adjust your treatment plan as needed. Remember, high blood pressure often has no symptoms, so these checkups are crucial in managing the condition effectively. It's important to note that managing high blood pressure is not a one-time task. It requires a lifelong commitment. But don't be discouraged. With the right approach, you can take control of your blood pressure and reduce your risk of serious health complications. In conclusion, managing high blood pressure involves a balanced diet, regular exercise, possible medication, and regular checkups. It may require some adjustments to your current lifestyle, but remember, it's all about taking small, manageable steps towards a healthier you. Managing high blood pressure is a lifelong commitment, but it's certainly achievable. It's about making healthier choices every day, and with time, these will become second nature. So take that first step today towards managing your high blood pressure. Your future self will thank you. Let's recap what we've learned about high blood pressure today. High blood pressure, or hypertension, is a common condition where the heart has to work harder to pump blood. This can lead to serious health risks, such as stroke and heart failure, affecting nearly half of adults in the United States. Blood pressure readings are measured in millimeters of mercury, with 2 numbers given. The top number, referred to as systolic, represents the pressure during heartbeats. The bottom number, known as diastolic, is the pressure between beats. High blood pressure can be caused by a variety of factors. These include your diet, exercise routine, family history, and any underlying health conditions you may have. There are 2 types of hypertension to be aware of. Essential hypertension has no clear cause and is often linked to lifestyle factors such as high salt intake. Secondary hypertension, on the other hand, is caused by other health issues. Risk factors for high blood pressure are many and varied. They include age, family history, and lifestyle choices. It's important to be aware of these risks and to take steps to mitigate them where possible. Recognizing the symptoms of high blood pressure is crucial. In severe cases, known as a hypertensive crisis, symptoms can include chest pain and dizziness. These require immediate medical attention. Managing high blood pressure involves adopting healthy habits. A balanced diet and regular exercise can go a long way in controlling your blood pressure. In some cases, medication may also be necessary. In conclusion, high blood pressure is a common but serious condition. It's essential to understand what it is, what causes it, and how to recognize its symptoms. Equally important is knowing how to manage it, through lifestyle changes and, if necessary, medication. Remember, Knowledge is the first step in taking control of your health. Stay informed, stay healthy,